the situation in Karnataka, which is the state worst affected by coronavirus in terms of the daily numbers, and capital Bengaluru is the city with the most active COVID cases in India. The state is trying to change its approach to release the strain of those seeking medical help for COVID emergencies. Let's go across to Maya Sharma now for more. And Maya, how are they trying to manage the cases on the ground? Even though there has been a lockdown, cases are still very high.
Cases in Karnataka still very high indeed. The numbers have come down from the absolute high of when it crossed 50,000 new cases a day in several days when there were more than 40,000 cases. The latest 24-hour data shows 39,510 new cases in Karnataka, a few hundred more than the previous day. Bengaluru, though, it's come down to about 15,879 cases. The positivity rate in the state still very high at 33.99%. Tests and vaccinations both stand at well above 1 lakh, but still perhaps lower than the peak numbers that were happening. Now, what is the state government is trying to do is trying to make sure that patients in desperate need of help do get the attention they need. We've seen terrible stories. We've heard lots of appeals from people looking for oxygenated beds, looking for ICUs, looking for oxygen. And what the BBMP is trying now is to decentralize COVID management. In each of the 28 assembly constituencies of the city, there will be a triage centre, and patients in need of medical help can go there directly. They do not need to call the BBMP helpline. They do not need to call an ambulance. They can go there directly. They will not be refused. And doctors there will perform triage. They will decide what the next step is for that patient, whether they can manage with home management, whether they have to go to a COVID care centre, or whether they have to go to a hospital for an oxygenated bed or ICU. That will be decided at these triage centres. And also the oxybuses will also be introduced. They will be parked near hospitals. What will these oxybuses do? They'll provide oxygen to at least up to 8 patients at a time, providing emergency help if the patient cannot get into the hospital for that oxygen. The state has also floated global tenders for 2 crore vaccines to actually get the vaccines into the arms of the 18 to the 44-year-olds. That is also very important, and has also placed an order for another 3 crore vaccines for the rest of the population. Free food at Indira canteens also until May 24th, as Karnataka tries to help the people hit hard by the second wave of coronavirus.
All right, Maya, thanks so much for joining us with those details.